Okay, gang, it is Wednesday. That means it's Hump Day. Time for Hump Day Happy Hour with Dennis in the Know. This is your backstage pass for current trends, politics, and education in the dental world. As always, we are live tonight. We are live over a beautiful bottle of Belglas Pinot Noir, very reasonably priced. Beautiful little Pinot Noir. So I should be happy within 20 minutes or so. So these are my compadres. This is Dr. Chad Duplantis. To my left, below me, is Dr. Jennifer Bell. You know her as JB. We're all practicing dentists. We are all educators, and we are all business owners. And our job is to bring you in the know. JB, there's some big stuff going on in the news, right?
Huge.
So, but don't go anywhere, because we have an amazing hygienist. Chad and I got to sit down and speak with her at the last Chicago Midwinter, which I might add, JB was not in attendance for.
She wasn't there.
And anyway,
You know what? My attendance this year will have fireworks.
I hope it does. But anyway, at one of the dinners, we got to meet a lovely young lady. Her name is Crystal Spring, and she is helping people all over Montana, and has a mobile access healthcare outreach that she works with to provide hygiene services and referrals. So we're going to talk with her in just a minute. But in the meanwhile, JB, why don't you fill us in on the news?
Let's go. So first off, I think just coming off of all the chit chat that we just did, it was actually reported in the HPI, which the ADA has been tracking now for several years since really COVID came into place, and they needed to see how the economy and activity levels and the practices were being impacted by it. But they've continued to collect the data beyond that date point. And there was yet another downturn or kind of low tick in activity level for the 1,200 offices that they currently are interviewing and collecting data from. And most of them are citing short notice cancellations, less than 24 hours. The average percentage full was around 83%. Staff shortages still ranked up at the top as far as reasons why they're not at full capacity. But in addition, short notice cancellations from patients also hit the mark. And I do think, if it's anything like my own practice, certainly we're seeing cancellations for sickness related to our patients, but as well as staff members as well. So I think that is a telltale sign in the HPS statistics. In addition, we had kind of seen it level off a little bit for dentists expressing some concern about the economic outlook for the U.S. And actually, the dentist economic outlook was still slightly higher than the average U.S. population. We saw another downturn of the dental outlook from dental professionals over the collection data period in October. So, I do think that there's some long set in realities coming with this inflationary change that we're all having to adjust and accommodate for, and no real end in sight, at least from my perspective, of what I'm seeing as far as costs are associated with staff, supplies, and laboratory fees. So I do think there's a little bit of realization sort of sinking in. But today was a pretty big day because it was a huge announcement that came out of the federal government. Medicare dental services did get approved. It looks a little different than the original package, which had dental benefits for all. That is not what we're seeing in this currently passed package, but it does have dental benefits for medical services that require dental treatment prior to or during care. Currently in 23, which will go effect in January, we see dental benefits being offered to organ transplant patients, valve replacement patients, and valvuloplasty patients. They can go and seek dental exams and treatment that may be beneficial prior to or during treatment for their medical conditions. In 24, we see head and neck cancer hit the spectrum, and they will be offered dental benefits I'll be honest with you, I'm a little disappointed that if we're going to be offering dental benefits for patients that had neck cancer wasn't included in the original batch for coverage, because we've seen lots of negative and ill effects from radiation treatments for head and neck cancers that do require dental treatment, directly correlated to their cancer treatment. Be that as it may, 2024, you can start billing Medicare for those services as well. There's still a lot of clarity that needs to be cleared up as related to who can file for these services, how doctors and dentists will be compensated for those services, what the fee schedules will ultimately look like. One note in this package that came out today relating to the overall Medicare package, which included dental services in it. Physicians are going to be sad to hear that 3% bump in fee increase that they have experienced over the last few years will be sunsetting in the end of 22. And so their fees will be reset. And in fact, it didn't look overly optimistic for the fee schedule reimbursements for physicians in general. There is a bit of a reset to happen in 23, which is quite unfortunate considering that most of us as business owners, costs are going up. So not sure how the math will all work out with that one. The CDC continues to investigate a pediatric office that had several of their patients diagnosed with non-tuberculosis mycobacterium. They were treated for this condition. I think all have survived from the condition, but it seemed to be directly correlated with the number of patients that came out of that particular office. So they are continuing to investigate, whether this dental office ends up being the guilty party of contributing to a bacterial spread. I think it continues to bring up the conversation, which we talked about several months ago on our page, about the requirements of dental waterline testing. Currently, it's under a recommendation status with the CDC. There are parameters that you can follow if that's a program that you would like to partake in. We do it in our office, which is part of the whole treatment of the waterline system. But then we also test and check to make sure that our bacterial levels are staying under that 500 parts per million that is recommended by the CDC. But when we see cases like this come out, I think it continues to beg the question, when will the requirement come forth where dentists will be required to perform certain treatments of dental water lines and certain routine maintenance and management of the dental water lines as well. So probably advisable at this point to start brushing up on that if you're not currently implementing a program in your practice, to at least understand what might be required. And out of curiosity, probably not a bad idea to test them to make sure that your water lines remain clean. In addition, I thought it would also be interesting to note that the student loan repayment program that we all talked about a few months ago has now been put back on hold. 6 states are now in litigation with the federal government, citing issues with a particular law. So if you were one of the many guests who were going to be eligible for this student loan repayment program and forgiveness of their student loans, just know that that program has been put back on hold for the foreseeable future. It's now locked down in litigation. I would be remiss if I did not remind all of our viewers, as I'm sure most of you know, because you watch this show and your whole goal is to stay informed and in the know, that on Tuesday, it is election day. If you haven't already voted, the only way that you can complain about the things that are happening in our communities and in our government is that you at least express your democratic right to get out and vote. I don't care who you vote for, but you must be present and participate in the process. It is so vitally important for the democracy that we love and enjoy every day. So if you don't vote, don't talk to me. I'm just kidding, but not really. A little bit, a little. Get out and vote. And don't forget, for our friends in Massachusetts, question number 2 on the ballot relating to medical loss ratio. Hot topic in the dental community this particular election cycle. So if you're in Massachusetts, I think all of the dental organizations have weighed in on how they feel about supporting this particular issue, but be sure to cast your vote. And with that, that's the news.
I do want to mention that Michelle Petrie from GC America is watching tonight. And we actually did meet Crystal at the GC dinner in Chicago. And I know that GC absolutely helps support Crystal in her endeavors. So want to say a big thank you to GC America for all they do for this program. But with that, Chad, would you introduce our guest?
I'd be honored to. I'm sorry. I'm just chuckling a little bit on the inside, Jeff. So anyhow, Jeff is correct. We did meet Crystal at the GC dinner. Many of you know GC for their restorative products, but really they've got a lot of preventive products out there, and they've got a lot of products that promote dental health. So when we met Crystal, I was very intrigued by her story. Crystal actually grew up on a reservation in Montana. She has since made it her passion project, if you will, a mobile dentistry clinic. But beyond that, that's not just all she is. She's an incredible hygienist. She's won several awards in hygiene. She's a mentor. She's an entrepreneur. And she's a real go-getter in dentistry, and she's an advocate for all of us. So without further ado, I would like to introduce you to Miss Crystal Spring.
Thank you. That was fun. You can keep saying nice stuff about me, Chad. That was awesome.
I'm done. That's
all.
That's all I had.
Just wait till we're off air.
Oh wow, yeah.
It was all made up. Well, welcome. Thank you for being here.
Thank you.
You look so different. Did you brush your teeth? That's what it is.
I brushed my teeth.
Yeah, I thought
good.
So.
Well, we're glad that you brushed your teeth, because hygiene is of utmost importance.
Really important. Yeah.
So you've got a lot of accolades behind your name, but if you wouldn't mind, tell us a little bit about where you started, where you've been, and where you are now, and then we've got a bunch of questions for you.
Definitely. So like Chad said earlier, I grew up on a Native American reservation in northeastern Montana. I think a lot of you, when you think of Montana, you're thinking of Yellowstone, you're thinking of Los Angeles, where I live. I live in Bozeman. I grew up in the northeastern corner of Montana, so really, really close to Canada and North Dakota. I think we were like 70 miles from the Bakken. We had access to care issues where I grew up, and we still do have access to care issues. Just about, it was a year ago, July, I was at a dental meeting, and somebody brought me like this picture that said that the Fort Peck Reservations declared a state of emergency for oral health in America, like where I live. And they have some really amazing programs that they're trying there. And that was just really hard to hear. So I grew up in an area of really, really low access to care. I'm not an enrolled member of a tribe, so I didn't go to IHS. We only went to the dentist when things hurt. I did have ortho. I was able to do some of those things, but it wasn't really something that was just available to my family all the time. And if you know these rural areas, and we know these HIPSAs or health provider shortage areas, that area is still very much an area where it's hard to get health providers, let alone dental providers, though we are health providers. I started out in mobile because 3 of my grandmas had lived in nursing facilities, and it was really important to me that they were getting care. And when I found out they weren't getting a lot of care, because we know how hard it is to get someone who's in a nursing facility into an office, I started going in and working there. And it was a crazy little scene on Facebook one day. My first cousin, she wasn't able to make a dental appointment with the health service that she has. So she was waiting in line, and she kept saying, like, I've been here all day, I haven't been seen. And I thought, oh my goodness, I have mobile equipment. I could come and help you. And I actually contacted a family friend. I wanted to work for Indian Health Service, but I wasn't going to move home. And some of the rules that they have. I couldn't go and just work a week there and help and, you know, come back and forth, but I was able to work for a tribal program, a 638, and that's how I started working in school-based clinics. I'm trying to think of like what else I could be missing. It was just always really important from the minute I started doing mobile. I had a small grant that I got through the American Dental Hygiene Association, and I like to tell people that I bought all this equipment off a dentist in a back alley. It was more like a bougie little coffee shop in Bozeman, but I bought all of his equipment because he was moving somewhere. And it meant everything to me that I would be bringing equitable services to the patients I would be seeing, because if they could be better off somewhere else than getting care from me, then I wanted that for them. So that's always been a big thing with me.
I think that's really an awesome passion project. And you know, one of the questions that I have, which is a little bit off topic, but I just out of curiosity, do you have any idea the numbers of people in your area that don't have good access to dental care? I mean, is it thousands? Is it hundreds of thousands?
Well, there's not hundreds of thousands of people in Montana, but I think
Right.
if you ever look at the HPSA map, it'll tell you which states. They're most like rural areas are considered health provider shortage areas, whereas some metropolitan areas. So like, I wish I could pull up the map, but there's a whole map that will show you. As far as like how many, I think it's a lot different right now because there are actually people who, after the pandemic, they're seeing how important oral health care is and they want to get in, and we just don't have enough providers. So.
Well, I think that's important because I think it's probably partially because of the message that you've brought that those people are starting to see that too. So that's pretty awesome. So
Crystal,
you don't have to pat your own back, but I will.
Yeah. So I've got a question. What's the deal with the long snapper at Montana State?
Oh, football? Is that what you're talking about?
So no. If anyone is, I don't know if any of you saw this, but the long snapper from he like, yeah, you had
so
one job
at that game, and it was
Were
crazy.
you really?
And I'm like, I don't go very often, and we were standing like right where he was shooting. And it was crazy. We like didn't go to the bathroom and we saw it, and like the whole place went absolutely crazy. It was awesome.
I can't even imagine, but totally off topic. I'm sorry. It was all I could think of when you said Bozeman. So actually our good friend and Dink Bobby Pappard has a place in Emigrant. We always fly into Bozeman and go up to his place up there. But my question is this, so how, you start this program, how do you find the people that need you, or how do they find you, or how do you find them? How do you all connect?
So we started this program. I just want to talk a little bit about what it is, because we actually, dental hygienists in Montana, they can have direct access if they want. So I started out working in nursing facilities with direct access. That means I wasn't under the supervision of a dentist. The dentist that I worked for would see any patients that we were able to refer. It was actually worked great. I didn't have x-rays at that time, but these were patients where it was more like palliative care. When I worked for the tribes, we were under the supervision of a dentist, but when we first started our nonprofit, we weren't. I had this whole thing in my head that it would be really hard to find dentists that would want to work with us. And we've been so lucky. We have more than enough dentists. So our program, we work with teledentistry, and we have several dentists that we work under. And that's been really, really awesome. But as far as like how we get new facilities or schools, it's pretty much word of mouth. Montana is a really friendly state. People just talk amongst themselves. We were in one school, and the superintendent loved what we did so much that he sent out kind of a brag to his friends, like, we just had Smiles Across Montana in our school, and then that school will call you. So it's pretty much word of mouth right now. We try to mainly be in areas that really, really need us, but we're finding that's everywhere right now.
How are you supported and funded so that this mission work can continue? And then how do the dentists have that kind of cohesive relationship so that if you identify more severe issues that do need direct management, can they be referred into a dental practice? Are they participating in the same global reimbursement structure? I'm logistically trying to figure out for other states that have similar laws, this certainly could be a reproducible model for access to care.
So I think this could be yeah, exactly. I've always wanted it to be really replicable. I think that, so how we go about it, so we're just like a dental office. We bill for the dentist under the dentist that we're working with. We try to have them at least be present once a year for an exam, but we do a lot of teledentistry. So that was always our goal, but now we're so big that we're not able to do that all the time. But how we are reimbursed, so I am a dental hygienist by day and a grant writer by night. Actually, we've grown to the size where I have to say I loved being a dental hygienist. I loved working in private practice. I held on as long as I could. The dentist that I work for is the sweetest, kindest man, and he did not fire me. And I messed with him bad, just saying like, I love public health. I've got this clinic I could go to. I need to be there. And he kept me on until it was too late. I don't know how the whole staff didn't hate me, but saying that, like, I really, really loved what I did. Now we are funded. So we're a nonprofit. We're strictly a nonprofit. There's no business side. We're a nonprofit that sustains on grants. A lot of the times we do bill Medicaid, some insurance. We have a scholarship program for people who can't pay, or it's really hard in school-based programs, so they can opt into that. And then we have a foundation that helps us with that. These are things that I wasn't even thinking about it when we first started it, but it just kind of evolved. And we have so many amazing partners. We partner with Montana State University Nursing Department. This is our 5th year. We're part of a $3.9 million grant for oral health care. We're doing some stuff. We've been in talks with the University of Washington about doing some teledentistry things with them, because we do more teledentistry than anyone in the state. We do it all day. And we would be so excited to be able to bring some of these dental students in. So that's pretty much how we do it. I would say it's kind of like an FQHC, but we don't get that kind of reimbursement. So. Looks like Chad's trying to talk.
I was muted. Jennifer had asked us prior to the show to mute ourselves for when our podcast hero comes in and converts everything. And then I forgot I had muted myself. So, anyhow, sorry. Anywho, for a lot of these people, you all may be the only medical provider that they see. And, do you all do any screenings that are medically related as well?
We do. So we were talking about this earlier. So, medical dental integration is a thing. I think it's really important. I think sometimes in dentistry, we're thinking like, okay, they're going to be doing our job, but there's so many things that we need to be doing. I speak a lot on like what is actually your scope of practice. Your hygienist should be taking temperatures. They should be taking their heart, or taking their blood pressure. These are things so we've always kind of strived to be a little above and beyond. So it's really, really important. We do oral cancer screenings, and I have done a lot of work with my hygienists as far as we're not just looking at their medical history to see if they're clear for like what we can do for them. We're looking at their medical history to think of like, okay, so your dad was diabetic. This runs in your family. These are things we need to start talking about. Empowering children even to be taking care of themselves, knowing that they are responsible for their health, not whoever they're living with or whatnot. It's just really, really important because, we know in some demographics, so I think the percentage of Native Americans with a predisposition for diabetes is 14.5%. Then the next largest group is Hispanic, then Black, and then white. And so that's, to me, I'm like, well, why? Maybe it's genetic, but maybe it's access to care. So it's really, really important because we look at periodontal disease as one of the biggest causes of diabetes. So all these things are linked, and we're looking at their medical history as more of a baseline and a roadmap than just, okay, we're clear, we can clean your teeth.
I've got a question, Crystal. So,
awesome.
You're looking at all these other things, and I'm sure in the course of working with a lot of these, rural groups, that you've got to come across some signs of negligence, some signs of potential abuse. So what do you do in those cases, and how is that handled? And how do you view your place in looking for that or observing that, and what your responsibilities are?
Yeah, so thank you for asking that. A lot of times we'll see kids and it looks like they haven't brushed their teeth ever. You've got that orange plaque, and like if you disclose that, like you could scrape half of their tooth away when you're starting your prophylaxis. And that happens a lot. It's one of the things I think is really important with our program, because I don't believe that shaming helps people to elevate themselves and take better care of themselves. So like one of the things I've always told people before you like jump on somebody for not brushing their teeth, like I want you to whisper in their ear, like, do you have a toothbrush? And I think that's hard for us to imagine, but there are so many people out there who don't have a toothbrush, or someone's using their toothbrush, or just a million different things. And I think that, here we are, dental professionals. We were all like lucky enough to make it into school and have the education to understand how important it is. I will say that we see a lot of holes in kids' teeth. A lot of them don't hurt, and so if you can think about, maybe they're living with grandma or their aunt who has other people that she's caring for. I was just really try to, so if my kid had a cavity, I'd probably be crying, because I cried once before. Like I'd be running off to see which one of you could help me first. But if sometimes people have a lot bigger problems than a cavity in their child's teeth. And so we try to remember that. We do work really closely with schools and counselors at the schools, anyone who works in the office, because most of the time it's not an issue of no one would take that child. It's they don't have a car that runs very well, and they were on their way, or the ride they had that day didn't come and pick them up. And it's very understandable. Like offices can't run like that. So we are very aware of why things happen, and we try to be a liaison in between that. But I think we've only had one issue where we worked with Child Protective Services. I have a friend, Alyssa Aberly, out of Colorado, and she actually speaks on this, because it is important that we do report these things. And I was really humbled, because I work with these populations, and I thought, man, I've hid behind every school nurse and school counselor for a long time. Like we do report it, but we rely on them.
Right. And there's got to be a really fine line, as you said, between, you can't just look at a child who has not had any dental care and say, okay, this is abuse. There's a lot of things. It could be ignorance. It could be, just no dental education whatsoever of the caregiver, or for the caregiver. And so I guess it's got to be hard making that determination. And, how do you know when it's time to take that to the next level? I imagine there's just got to be a lot of extra legwork on your part on the sidelines to try to figure that out.
So we were talking about that earlier today. I was talking with someone, because if you think about it, we are grant funded, and a lot of those funds are for referrals. Our whole system. So when we get a consent from a parent, someone signs it, we don't just see that patient. We actually call the parent and ask them if they know what they signed. I think that's really, really important. They might already have a dental home. They might be going somewhere. And if they do, we're like, okay, well, we're not duplicating services here. So we can actually see your child, give them a new toothbrush, talk to them about their plaque levels, talk to them about this, but let's keep them on their regular schedule. And so we do, a lot of times you might have a family member, like I've called people and made dental appointments for them because they were afraid to call. I think sometimes when that's not something you do all the time, and maybe you have an accent that's different, or you're just worried about, maybe not saying the right thing when you call. So we will help with things like that. But we are grant funded for a lot of our things. So we're able to do things that someone who is in a for-profit, it might be a little different.
I love your conversation points about non-shaming, because I think we could all learn, even in a high affluent area down to, a low socioeconomic status, how we talk to patients and educate them and understand, to Jeff's point, like, is it neglect or is it just doing what you absolutely can to survive? And where is that fine line when a foster parent or a grandmother takes on a child that he or she had not planned on having, and they're keeping them alive, they're keeping food on the table, shelter over their head. Like where are those lines of just absolutely surviving and doing the best they can? I think you could write a whole book, Crystal, about how to communicate with patients in a non-shameful way, because I think your point is valid. The reason people don't seek care oftentimes is because they think we're going to reprimand, we're going to get upset with them because they're not doing what they're supposed to be doing, and not really meeting people exactly where they are in life. And I love that. So we're going to have you build a whole talking points PowerPoint on how we talk to patients in a safe and productive way.
Because we had banter about this yesterday, JB, with the radiograph refusal thing. Not shaming.
Yes,
I'm
exactly.
sorry, Crystal.
No, that's
the same thing with fluoride too. I try, because a lot of people, that's not something they want. And to maybe me, who works in public health, I'm like, oh, come on, you need the fluoride. But you need to hear people for what they're saying also. So I agree with that. Something I think we don't think of in private practice is so many, like if your parents are divorced and you're staying at dad's and mom's and you don't have a toothbrush at dad's, and maybe, these kids today are going through a lot. And I think those are things that I've probably always given out too many toothbrushes at the office, but we do that a lot. We'll actually ask kids, like, so how many people live in your house? And we will give them way too many toothbrushes. But again, I beg, borrow, and take anything that's left over at any conference. I'll be the person talking like, hey, do you have free stuff? We'll take it. So anything we can to, set them up in a good position.
Wait, are you that person that will wait on the 1 hour line at the booth for a toothbrush?
No, I'm that person who will come behind and be like, hey,
at the end of the show,
at the end of the conference, I can take them. I'll grab them. I brought an extra suitcase.
And a lot of times a lot of the companies, they'll have like misprints and things like that you can take advantage of to, know.
I mean, we've just been so lucky. We've had people nominate us for things. Like we won a bunch of toothbrushes from Crest last year, and we try to use a lot of really quality products. So I think that's really important. I think it's the education, I feel, is the most important thing we do. We do a lot of sealants. We're not just a sealant program. So we do intraoral pictures as soon as every patient that we see. That's how they see the dentist. We take tons of different intraoral pictures. We take x-rays, not all the time. So if we look in someone's mouth and we know they need to go to the dentist, we're just going to send them to the dentist and let them take them there. We try to be really just kind of cognizant of, we know you're going to be a referral. Trying to think what else. So we use a lot of glass ionomer. So that's with the Fuji from GC. That They have it's the Fuji EP. We use that a lot. I wish that glass ionomer was used in regular practice a lot more. I think we're doing a lot of resin sealants, but glass ionomer sealants, you can use them when there's slobber all over the place. They really are amazing. We're seeing such great things with those. And we actually started sealing kids' teeth at a much younger age. And we started doing that because we would see very, very young children, and there's nothing we could do. They're 4. We have to refer them to a pediatric dentist for surgery. The mom's super upset. That's a really hard time. These parents, it's not just about even getting in. They're very worried about their child going under and things like this. And so I started sealing really, really young kids' teeth because we'd see the older brother and you'd see the younger brother sitting there, and you're finally to the mom, we could try to put, glass ionomer sealants on your baby's teeth and, monitor them as much as we can so we don't have this. We also
Crystal, you are speaking my language. I love this.
But I love it because I think that everyone should be doing this in their private practice. This isn't a public health measure. This is something you could be doing in your office. You can be applying silver diamine fluoride. Why would you ever watch an area when you could put some SDF on it? Then you're not watching it get bigger, and you can restore it from there. So
I've argued for this all the time. Why are we using resin-based sealants? Maybe the glass ionomer is not going to be as strong, but the whole time it's on there, and even if it breaks down, there is never decay around it. No. Whereas when a resin sealant breaks down, we very often will find decay, and then we wonder, were we the cause of that decay? But that never happens. You cannot do anything wrong by putting a glass ionomer sealant down on a tooth as early as possible. So that just excited me to hear you say that.
And I hope there's a lot of private practice dentists doing that, because you could be keeping these children from needing surgery, because I know a lot of kids don't. I think we wait too long. Some of the tactics I've used with moms, they want to do this. And I've actually said, well, little Timmy might scream, but actually it can see so much better. That'll be great. It'll just take a second. Yeah. We'll apply some fluoride when we're done, and it's going to be better in the long run.
I'm going to say it. We have placed Fuji Triage for years and years as our sealant protocol. And I love that you're doing that.
Yeah. I think we do place some resin sealants because there's some I just love. But we mainly use glass ionomer.
And I think that's a great message to our good friends at GC. I'll never forget going to GC Symposium last year, and there's so many people that just love glass ionomer and its effects and what it does. I'll never forget the story that Brian Novi told about the glass ionomer crown. I mean, he had a glass ionomer crown placed and it broke, and he was like, I don't care. I want another glass ionomer crown. I'm like, okay, whatever, that's great. So I love that you all realize and actually utilize the benefits of it, because it's exposed to the oral cavity. It's going to get recharged if they brush their teeth. And I think it's just fantastic, the service that you all are providing. So
thank you. And I love their smart fillings, smart crowns. I mean, it's amazing, the things that you might not necessarily have to numb a child up. So some of the more fearful patients we get are kids that had surgery because they just know they went into a dental office and they came out and, they have crowns. And I think, anything you can to avoid that is probably best. Keep them in your practice, keep them, in a place that they feel safe. So I wish more, general practices would use it, and maybe they'll hear this and be like, that sounds awesome.
I totally agree. And I hope that message transcends, and I'm sure that it will. So I have we're getting close here, but I do have a question. I have 2 questions, but the first one is, where do you see this heading? I mean, do you feel that you're confined by the borders of Montana, or do you feel that you have the energy to expand this? Because I can guarantee you that I know Montana has a lot of need, but there's even your neighboring states that probably have the same need. Do you have the energy to expand it?
So it's funny that you say that. I feel like I have the heart, and I feel that we have something that works well. I want to say, like, some of the things that are really important to me is we don't come into a small town and area to put this small town dentist out of business. We want to keep them with our patients. We want to refer to them. We want to, help them, because they're what is going to hold everything together. I think continuity of care, because we do become a part of their dental home. They are not going in for their cleanings. They're not being consistent. We actually call. So if they are seeing the dentist, when we refer them for fillings, we'll call and say, hey, did you schedule an appointment? I think it's really important that there's the way that we're doing things, because mobile, I've heard from a lot of people, because I've had weird conversations, and I know how I was doing things and how important it was for me to be bringing great care to patients. But a lot of the skinny with mobile is people come in, they do services, they bill out all these stuff, they never come back again. So I think that that's something that is really, really important, that it's not just a come in once a year, see patients. That's not good for anybody. I love that we work with dentists. I love the dentists that we work with. We have a really great relationship. And so anyone in any state could do something like this. Where the barriers a lot of times is if you were out, like if I was a hygienist working on my own, that would be a lot harder. But this is completely replicable. And I'm a dental hygienist. I am very, very passionate, and I have way more energy towards this than a lot of people. But I think it's something a ton of people could do. And I would love to, talk and meet with other people who are interested, because I feel like I've listened to every complaint we've ever had against kind of what we're doing, or maybe fear of what we're doing. And I've actually listened and tried to make it better. Tried to help, try to make it work, because I just say that we're really mission-based. And if we're like holding to our mission and doing what's right for the patient and what's right for people, things turn out good.
I think, the moral of the story is you're fulfilling a need. You're not trying to turn a profit. And granted, you in speaking with you earlier, I realized, and it made me feel really good, that you have this big concern about what the dental community thinks of what you're doing. I think there was a term back in the day, the carpet baggers. You're not carpet bagging. You're actually going in there. You're fulfilling a need, and you want to work together with the dentist in that community and actually promote them and see their success as well. And I think that if that message transcends as well as the others do, then this is a nationwide thing. And I think that you could spearhead an amazing program nationwide.
I love that. And who knows, maybe we'll do that together. Who knows? I'm up for anything. I think it's funny. I loved the office that I worked in. I loved it so much. I always worked 2 days a week, and now I work like 6 days a week in what I do. So it's kind of crazy how just having a mission will really help. I will say that it's a big part of what we do is medical dental integration. And if I could ever just urge people to think about what we could be doing as part of the healthcare team, and maybe not worry so much about, like, now healthcare providers, there's just a new code that came out so they can apply SDF and things like curodont and desensitizers, which is going to help us a lot. It's going to, if they can be doing that at well child checks. And I know that sometimes we get a little nervous about that, but from what I see, if people could see what we see on a daily basis, and this is throughout the country, these patients with these holes in their teeth, they're not going anywhere. So it's good that we can get them in somewhere. And I actually teach nursing students what to look for. We teach them about oral cancer and like oral cancer screenings and using intraoral cameras. This is at Montana State University. They're just amazing. And I think it's really, really important, because I look at myself as maybe the only provider someone will see, but these nurses, nurse practitioners, all these people, they need to know about oral health, and they need to have some things in their toolbox that they can at least do something to help their patients.
I don't think I realized you were teaching at Montana State.
So I shouldn't say teaching, but I get to come in and I teach them.
No, that's awesome. Can you teach the long snapper to aim for the numbers? Just the numbers. Just, yeah, not the stands, the numbers. Like right here. Just
so
sorry.
Jeff has a way of really bringing things down, but we're getting close to time. And my last question is this: as we close out, I got to ask this. For those of you that don't know, Crystal kind of lives a Yellowstone life in Montana. I mean, she's got her husband's like the rodeo star, her kids rodeo and everything. So how realistic is what goes on at Yellowstone?
Oh my goodness. So I think it's really funny. So my husband's quite literal, and it bothers him that like just the geography of it. He's like, there's not a reservation close to this town, and just like funny stuff. I would just say, like, I know all the ladies like Rip, but I'm like, oh, he's from California, and it's kind of funny, and a lot of people probably really hate me right now because they really, really love him. But I'm like, I know some real cowboys, and he's probably not it.
Does this work?
Oh yes. So that's always funny. The cowboy. I have tons of cowboy hats that aren't very Western, and yeah, I get a lot of crud from just mainly my family. Everybody else is like, "Wow, that's an awesome hat," but my family's like, "I can't believe you have that on. That's so embarrassing." And real cowboys don't really wear pointy boots either. So
yeah, I don't have any pointy boots, but hey, can we come visit to Montana? Can we have a Dinks Montana visit?
Think we should. And
we've been talking about this, Chad. Bobby Pappard has offered up his place for a Dinks retreat. Whether he
Bobby
knows
doesn't
it or
have
not.
horses, though. We can stay at Bobby's and go ride horses with Crystal and her family. There you go.
Absolutely. He has ATVs, though.
Yeah. Hey, there you go. Okay.
Yeah, we have some stuff, but I mean, you could drive around a snorkel lift to, we've got construction equipment if that gets you excited. I don't know.
I like that too.
Always wanted to drive a bulldozer.
No, Montana is absolutely, I don't know if you guys have ever been. It is lit like one of the most beautiful places I have ever been. The thing about big sky, I have never seen a bigger sky in my life. When it gets dark there, it gets pitch black dark, and you see stuff in the sky that you've never seen in your life.
So I also have something I'll put out there is you can get a volunteer license in Montana. Maybe we could bring something together like that.
All right.
Maybe Dinks give back.
Honestly, I think we're onto something here, because I would love to put something together where we could do some type of an outreach program, taking Dennis in the know, taking some of our, I mean, the people who are really engaged with us are people who want to give back. And so to be able to do something like that would be absolutely amazing.
I definitely think we should talk about it. I think a lot of hygienists reach out to me, but we're just as excited about Dennis coming. There are so many, like I said, we would go to areas that are hard to get to, and it's hard for them to get to the dentist, and we could do so much good. So it'd be, and it's so fun. So,
well, I'm in. Let's do a Dinks Give Back in Montana. So, Crystal, thank you so much for being here. Speaking on behalf of all of us, I just want to say we love what you're doing.
Thank you.
Really think
it was great seeing you again.
Yeah, I appreciate you guys.
Yeah.
It's nice meeting you, JB.
Nice meeting you too. I will be at Midwinter this year. Should we want to hang out?
Yeah, you'll be watching these two.
Remember when I was talking about shaming? So I'll be at Midwinter so I don't get shamed.
Yeah. Well, thank you. Thank you so much, Crystal. We'll be in touch.
It sounds great. Thanks.
Take care. Have a good night.
What a great guest, huh?
Great.
Yes.
I love her. I love her passion.
I didn't even get to tell her that Ange was born in Billings, my business partner, and grew up in Minot.
Yeah. There you go. Hey.
Yeah.
Oh wait, I did know that. That was a hot tub conversation, but we'll talk about that another day.
Talk about that later.
We're about that later.
Over coffee.
All right. Well,
Have a great week, boys.
You too. I guess I'll close this out. I want to thank Q Optics for always being the great sponsor that they are. I just want to throw a shout out to our good friends at GC and tell them how appreciative we are of what they do for all of us. And I just want to tell everybody to have a wonderful week. And remember, we all need a servant's heart. If you're looking for inspiration, look at what Crystal does. So thank you all very much and have a great night.
Good night, everybody.
Good night, everyone. And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.